Gallbladder function with numerous stones. Does a gallbladder filled with stones lose its function? Having gallstones does not mean the gallbladder has no function. These are two different concepts. I have gallstones, discovered during a checkup last November. I'm afraid of surgery because when I went to the hospital, they just told me to have it removed. They always say that if you don't get it removed, by the time you feel symptoms, it could be gallbladder cancer. The vast majority of people with gallstones will not develop gallbladder cancer. However, a small number, about 2 or 3 out of every 100,000 people will. The incidence rate is about 0.02. Gallbladder cancer is not as common as stomach or lung cancer. The probability is relatively low, and it's often discovered late. You can't let this small probability dictate your decision. Just because the stones aren't causing symptoms now doesn't mean they won't in the future. It's hard to say. Of course, some people go their whole lives without any symptoms. The most common solution is removal, because without cutting the gallbladder, they can't get the stones out. The benefit of removal is its simplicity. Removing an organ is not overly complex now, and is considered a routine surgery. There are two methods for preserving the gallbladder. One is the laparoscopic approach, where several small incisions are made in the abdomen. The gallbladder is then incised, the stones are removed, and it's sutured shut. The other method, which we perform, involves going through a natural orifice from the mouth to the gallbladder to extract the stones and preserve the organ. This method does not require cutting the gallbladder open, leaves no abdominal scars, and is therefore called a scarless surgery. Secondly, the gallbladder is not incised or sutured because its wall is not breached.